Good afternoon, everyone. Um, Welcome to today's panel. My name is Caroline Quo, and I have the pleasure of serving as Associate Dean for Diversity and Inclusion at the School of Public Health. For this signature event for National Public Health Week, we have the wonderful chance to hear from esteemed alum. You'll hear about who they are in just 1 minute, and we'll enter into a moderated discussion. I just love this chance to connect with our alum. We're a relatively young school, but our alum are already doing just such incredible things. So today, our goal was really to feature alum that are doing all sorts of diverse things in diverse industries and settings, who are all focused on the common goal of advancing racial health equity in different ways and applying their public health degrees in different innovative ways. I think that the second piece is that we really want to use this chance to kind of connect this afternoon. So we'll have plenty of time at the end for you to connect with these esteemed alum. We have a growing alum network, so I'm sure that the conversation today will also kind of excite you and encourage you to connect with our alum network in other exciting ways. So without further ado, let me pass to my colleague, Jamie Potter Rutledge, who will say a few words and introduce our panelists.
Thank you, Caroline. It's my honor to introduce our panelists. So we are joined today here by alum from our MPH program. And first I'll introduce Shane Lloyd. Shane Lloyd is a diversity and inclusion practitioner with extensive experience in higher education, public health, and nonprofit organizations. Shane specializes in conducting workshops on various dimensions of social identity with special expertise in the areas of race and socioeconomic class, and integrates research in behavioral economics, psychology, organizational behavior, sociology, and public health. Over the course of his career, he has partnered with academic departments, HR units, and senior leadership teams to develop impactful short-term and long-term strategies aimed at ensuring that all members of an organizational environment can thrive and contribute in meaningful ways. Currently, Shane serves as the Worldwide Consumer Inclusion and Engagement Lead at Amazon. Prior to joining Amazon, Shane held positions at 2 of the nation's leading academic institutions, including Brown University and Yale University, and as a consultant at Cook Ross, one of the world's leading diversity and inclusion consulting firms. Shane earned a Master of Public Health degree from Brown University and a Bachelor's in Behavioral Neuroscience from Northeastern University. Welcome, Shane. Next, we have Dr. Monique Brown. Dr. Monique Brown is an epidemiologist and assistant professor in the Department of Epidemiology and Biostatistics in the Arnold School of Public Health at the University of South Carolina. She is also president of Brown Research Consulting Incorporated that provides research consulting services for individuals and organizations. She received her Bachelor of Science degree from Bates College, her Master of Public Health degree from Brown University School of Public Health, and her PhD in epidemiology from the Virginia Commonwealth University School of Medicine. She completed a research postdoctoral fellowship and was research faculty at the University of South Florida in the College of Behavioral and Community Sciences. Dr. Brown conducts research in the areas of HIV, trauma, mental health, and aging. In these domains, she examines the associated health disparities and has published several papers in these areas. Her research in examining childhood sexual trauma and its impact on HIV and aging is funded by the National Institute of Mental Health. Welcome, Dr. Brown. Next, we have Catherine Nwachukwu. Catherine is a manager of research at the MA Center for Health Information and Analysis, where she has worked for over 3 years. CHIA, which is short for the Center for Health Information and Analysis, is an independent state agency that serves as the primary hub for healthcare data in Massachusetts, objectively and reliably reporting on the quality, affordability, utilization, and access outcomes of the Massachusetts healthcare system. CAT helps manage a variety of agencies' analytic products, including work on the Massachusetts Employer Survey and unplanned hospital readmissions. She is also the project lead for the agency's efforts to incorporate social risk factors into their public reporting of hospital readmissions and revisits, and is helping to support new efforts to systemically collect and report data on unmet health-related social needs and healthcare equity. Kat earned her Master of Public Health degree from Brown University in 2017, prior to which she served as an AmeriCorps member with City Year Boston for 2 years. Welcome, Kat. Welcome all of our panelists.
Thank you all. So at this time, what we would like to do is invite our panelists to give just some short introductions, and then we'll move to some moderated questions. Is there anything else that you all would like to just highlight about your work before we move on to moderated questions, or shall we jump right in? Okay, I'm going to take that as a jumping right in invitation. So I'll kick off with the first question. We'll kind of go in the order of Shane, then Monique, then Kat. So our first question for you is, what about your public health training has inspired you to advance equity, including racial health equity?
So I will dive in. I think that part of when we think about public health broadly, it's about how do we actually, I think of the health equity pyramid, and how do we actually not just focus on behavior change and awareness building at the individual level, but really get at the bottom of the pyramid around thinking about the socioeconomic circumstances in which people are engaging in their health behavior. And that perspective and worldview was monumental to shaping my career, because I had aspirations of once going into medicine, and then I read Harriet Washington's Medical Apartheid. That was a very difficult book, and I said, why would when I think of medicine as a consequence of reading that book, I think of medicine as an intervention, and I wanted to go further upstream in my work. So using the public health lens has been extremely beneficial within my work within higher education, within my work within DEI consulting, within my current work in corporate America, because when we think about employment is one of the major vehicles that allows people's access to health insurance, at least in the United States. Longer conversation, access to health insurance, the resources to put food on one's table, the resources to take care of one's family, and then thinking about where jobs are located and what flexibility people have, and the cascading consequences of the economic compositions of different geographies. All of that broader framework to understand the world and these upstream and downstream interventions, that public health lens is just invaluable.
Thank you so much, Shane. You started to touch upon what we'll learn a little bit more about, kind of what's inspired you. So we'll circle back to that. Thank you for kicking us off. Monique?
Yes, I think for me, in terms of my public health training, I think back to my first epidemiology class it was taught by Dr. Kate LaPan. I don't know if people probably know her. And I just remember learning so much about risk factors and what causes adverse health outcomes. And when I thought about that, I was always interested in HIV research. And I remember that, there were certain behaviors that put people at risk, but then there were certain communities that were at risk in spite of those behaviors. And so really, when I thought about just thinking about epidemiology and thinking about the statistics, I remember thinking that there was a need to really look at these communities that were affected adversely and think about why are we seeing these different numbers for these communities. So that was part of my public health training that really inspired me to look at racial equity. And then I remember after my MPH program, I worked in Boston actually, and I worked for the Boston Public Health Commission. And there we were looking at these adverse health outcomes, and we looked at different communities and looking at the differences by race, ethnicity. And really, I found that there were a lot of racial ethnic disparities in Boston, and there were geographic differences as well. So for me, I think my public health training sort of prepared me to look at these different questions, to raise awareness on health disparities, And then that was sort of the part of my training that helped me to really look into racial equity and trying to advance racial equity in terms of looking at the health disparities.
Thank you, Monique. I love that connection to Boston because that's where Kat is now. So Kat, take it away.
Sure, thank you. So I would say I've always been interested in advancing equity, and I participated in social justice and community engagement work during my undergrad, and then serving the city of Boston at a high school. But really, what my public health training gave me the tools and the language to talk about equity, and helped understand some of the root causes for some of the things that I was seeing in the community. And it helped me really hone in on the approach that I wanted to take to advance equity. So, during my time at Brown 4 years ago now already, really immersed myself in my coursework and tried to attend as many lectures as possible, not just the ones at SPH, but, at the School of Ed or at Watson. And then I also was working as a research assistant with the Force Safety Program through Hasbro Children's Hospital, where I had the opportunity to formulate communication materials about injury prevention and share those with community members in Rhode Island. And so I was kind of trying to get as much information as possible, as much language, as many tools as possible about public health, and with the idea that maybe I could narrow down to a specific aspect of racial equity or health equity in general that I wanted to, like, was it maternal mortality or, something else? And I never did quite decide on what that specific issue within racial health equity would be. But I think the information gathering that I was able to do and the knowledge that I gained from my public health training has really informed my current work. And it informs the sorts of projects that I'm advocating for at work, and the sorts of language that I encourage myself and my team members to use when we're discussing different disparities. So like the public health training definitely has kept the spark lit about advancing equity, and has helped make an impact in my work. So, yeah.
Thank you, Kat. Thank you to all of you. I think in different ways in these introductory remarks, each of you have hinted in different ways at what's kind of driven you to this particular career path. I'm curious, and I'm sure the audience is also curious to hear more. What influenced you to choose your particular path now, your career path now? Was it a pivotal moment? Was it a pivotal experience? Was it, kind of the intellectual work that was done? I think it's just great to hear a little bit more about that journey from each of you. So Shane, please go ahead.
Oh, this is an interesting and powerful question. So I will say from the start, going back in time, I had every aspiration of being a global health scholar, and I did not get accepted into the program. And that was actually a very, very good thing, because there's a whole broader conversation to be had around from a professional development, zero-sum game of where people can make their best effort. There's sometimes a glamorization of what's happening abroad at the expense of ignoring the inequities that exist right here within the United States, right down College Hill. So one of the experiences that I was able to have after not getting accepted into the Global Health Scholars Program was that, so I was in Brown at the MPH program from 2009 to 2011. Around that time, the Rhode Island Department of Health had actually received a lot of grant funding for full-time epidemiologists, but they had a hiring freeze, or at least that's the story that was told to me. So one of my advisors, Dr. Porman, was a researcher at Brown, and then also had a research appointment at the Rhode Island Department of Health, and kind of politicked to get a set of people to pretty much say, well, you can't hire someone full-time, but you could actually hire graduate students and then create an assistantship opportunity for them. She was brilliant. So I actually ended up working in the Health Disparities and Access to Care team at the Rhode Island Department of Health, working with special healthcare needs, maternal and childhood health, Office of Minority Health, refugee health. And I thought that was hugely expansive to helping me understand that I could actually make a significant impact in the livelihood of marginalized and underrepresented communities by race, ethnicity right here in Rhode Island, as soon as I started that opportunity. And I worked on a diabetes care strategic plan. I also worked on the 2020 health equity measures, and here we are in 2021, and still a long ways to go. So, so I thought that that was a really, really powerful and instrumental experience. And what actually ended up setting me on the course that I'm in right now is that we didn't necessarily talk about the work as, we talked about it from the standpoint of, racial equity, but we didn't think about it within the broader family of diversity, equity, and inclusion. And that was actually, I would say, the start of my journey as a DEI professional, thinking about what is the experience of the most marginalized communities, and then how do we use essentially a linked fate perspective to say, by centering the most marginalized, thinking of something like the curb cut effect, where a cut in the curb doesn't just benefit people in wheelchairs, but people who are pushing strollers, people who are temporarily injured, and here's an intervention that has maximal benefit for so many people. And that has been a similar philosophy that has really kind of guided my career. And kind of what was also a seminal experience was working in the Rhode Island Department of Health. I actually created this health equity quiz. So I was going around and, asking people different questions. One of the questions was, which of these racial and ethnic groups consumes the most WIC benefits? Black, Latino, well, Latinx didn't exist at the time, but Latino, Hispanic, Asian, and white. And even the individuals who produced the data that would have answered the question correctly all selected Black. So thinking about this very powerful embedded bias where even the people who are producing the data are still relying on stereotypical tropes. And then you present the data to them, there literally are not enough Black people in the Rhode Island to consume all these. Just do the math, everybody. So in any case, that really brought this larger conversation around how do we make sure that we're training health professionals around the social determinants of health and the socio-historical circumstances that inform these health disparities. So they ended up actually creating I worked on a team to help create a health equity curriculum that actually I think was still running until COVID. So that was actually pretty cool to leave that kind of lasting legacy. And I ended up actually wanting to publish one of my public health thesis papers and finding it difficult to find a job in Rhode Island, and then got a temporary position in a cultural center. And I said, okay, well, I'll just do this cultural center job by day and then work on this article in the evening. And once it's published, I'll just go back home to New York and get myself like a proper public health job. Completely ended up loving the job because it wasn't just your average food, folks, and fun cultural center. People might know it, the Brown Center for Students of Color, back then known as the Third World Center. That center was largely an anti-oppression center. Like, how do we tackle racism, sexism, classism, and their intersections to really create a world that can achieve equity? And I thought that was an invaluable lens that augmented the training that I received in public health, because I could really have the vocabulary around systems, groups, and some of how the disparities that we see in health are also a byproduct of socio-historical dynamics and the ways that we relate or not relate well to each other across dynamics of difference. So that's kind of the short version of how
I love this beautiful summary of that journey, which I think is just places central at it, passion for pursuing what is, what is a great, rich experience, and that piece of the journey is what kind of helps you find your way. I love that. And then just to say that Professor Perlman is still here, we still does amazing student-centered work. I love that shout out to her. And just, the continued partnership. We're so fortunate to continue partnering with the Department of Health. So just loved hearing about that part of your experience. Monique, on to you.
Yes, well, for me, I grew up in Montego Bay, Jamaica. And growing up in Jamaica, I remember when I was probably a preteen and HIV first came on the scene, and people were treated like outcasts if they had HIV, and it was something that was really unknown. And I know that was the case here in the US as well, where it was really an unknown factor. And so, but I was always interested in learning more about it. Unfortunately, it had hit close to home, where one of my friends' mom had passed away. And I just really, at that point, I had dedicated my life to really learning more about it, to spread awareness about it. And so when I came to the US for college, I started at Bates College. That's where I got my bachelor's degree. And during the last year of my undergraduate career, I actually did an independent study looking at governmental and non-governmental public health efforts geared towards fighting HIV in South Africa. Because at that time, and probably still now, South Africa has one of the highest rates of HIV. And so during that time, I was just really trying to find out more about it. I went to Brown, and then I was able to work with Dr. Emma Simmons, and I was able to be a research assistant for her. And we looked at the feasibility of implementing routine HIV testing in underserved primary care settings. And that, I don't know if that's the same format that Brown has now, but it was like, even before classes started, they're just gonna push you in the field. And, I don't know if it's the same format in the summer. In the summer, we had this internship before even classes started. So that's what happened, but I was so happy about it. And I was able to work with Dr. Simmons, and we were able to publish based on that data. And so after Brown, as I said, I worked for the Boston Public Health Commission. Then I went back to school to get my PhD in epidemiology. And another thing that happened at Brown, I was able to work at the Office of Medical Examiners, where I was doing research on homicides and suicides. So that's where my interest in trauma research began. And so when I was able to go back to school, get my PhD, I was able now to look at HIV. I was able to look at trauma, looking at adverse childhood experiences, and looking at the intersection of those two. And another area that really stood out to me was HIV and aging, because now we know people are living so much longer with HIV. It's now more of a chronic disease. So people are living longer, people are aging with HIV. And that's the reason I started to look more on HIV and aging, and the associated health disparities with that. So that was sort of my trajectory. Along the way, I did think about, I think like Shane, I thought about medicine at some point. And then I remembered that in terms of, instead of treating one person at a time, being able to look at that population level change, and how do we change things at the population level. And I think that has really served me well. And, after my PhD, I did a postdoctoral fellowship. And there I really started to do more HIV/AIDS related research, started to look at men who have sex with men, or gay and bisexual men, because they have some of the highest rates of HIV as well, along with Black population. So looking at the disparities there as well. And then after my postdoctoral fellowship, I came to the University of South Carolina, where I am now. And then I'm continuing to do work in HIV, aging, mental health, and trauma, looking at those areas as separate areas, but also intersecting areas of study. So that was my trajectory, and I'm happy to, answer any questions and clarifications later on.
Monique, thank you. It's so interesting to hear from both Shane and you so far. We'll hear from Kat in just 1 minute, but this idea of public health learning really taking place outside of the classroom. You asked, is the internship still going on? Each year, actually, we hear from alum, we hear how valuable that is. It's still a hallmark of the program, I think, for good reason. I can hear it from, just some of the stories that both of you have told. So Kat, on to you, please.
Sure. So as was mentioned in my introduction, prior to pursuing my MPH at Brown, I served as an AmeriCorps member with City of Boston. And that experience was really what ignited my passion for public health specifically. I too thought about medicine for a while, so glad to have that in common with Monique and Shane. But in City, I worked with high school students, and we were trying to address and overcome different barriers that students were facing, whether it was with attendance or behavior or coursework. And a lot of the time I realized that those barriers were health related. And so I wanted to get my MPH to get the tools to, help other people with different health related barriers in different domains of their lives, whether it was, education or housing or financial stability. And at that time, I was still really thinking I'd be in the sort of direct service aspect of public health, working directly in the community with people, kind of this like one-to-one or one-to-many sort of relationship. But then I came to Brown and I fell in love with biostatistics and the power of data. And I was like, oh, okay, maybe this is clicking for me. Maybe this is how I want to approach doing public health. And maybe I can take a step back from direct service and be more so a part of building this like evidence base and helping quantify some of the things that I was seeing with students at City or in the community with For Safety. And I'm sure, a lot of current students and alumni would agree that we read a ton of scientific literature as part of the coursework, which is a very good thing. And, whether it's part of the coursework or preparing for the thesis project and, and all that reading and then learning about methods and methodology, you realize like, there is like good data and sound methodology. It's a little bit more difficult to come by than I would have previously thought. So, when I left Brown, I really was kind of like, I want to work for a place that is looking at high quality data and, kind of analyzing reporting in an objective manner. And that's how I found my current position, which I've been at honestly since I left Brown. And CHIA has exceeded my expectations in that regard. One of my concerns, I guess, in stepping back from the direct service was that I wouldn't be able to make sort of the same sort of tangible impact that I, with City or the students, you could kind of see if a student was making progress, whereas, you step back from direct service a little bit and you're more on the data side. It's sometimes a little bit harder to tell if you are making an impact. But at CHIA, I've had the opportunity to, work on and help manage various efforts related to not only integrating discussion and reporting of health equity into our existing work, but also thinking about what we can and need to start collecting in terms of data that will be valuable to the public and to our stakeholders, many of whom are policymakers. And so I think for me, as much as it sometimes can feel like, okay, we have the numbers on health disparities, we've heard about it before. There is in fact so much more to be said, especially at the statewide level. And in Massachusetts, I think there is still a lot more to be said. And I'm really excited to be part of that work at my agency and, to help our stakeholders and the public get the data that they need in order to make better policies and improve things at sort of this population level. So still really, I'm only 4 years out of the MPH program, but feeling confident in this decision of kind of being on the data side of public health.
Kat, spoken like a true public health conversion, the power of data. It's such a beautiful segue, I think, into our next question, which is really about the COVID-19 pandemic. I think the COVID-19 pandemic, especially in regards to health disparities, has just underscored how important it is to have good data and good science. So this next question is really centered around that issue. So the question is as follows: COVID-19 and the related health challenges, such as poor mental health, and you can, think of many other related health challenges, they've really created widening health disparities. So how should we prepare the next generation of alum, to tackle these challenges? And you can speak to that in terms of what you valued in terms of your training, or you can just speak to it broadly in terms of your career experience now. Shane, please go ahead.
Oh, this is a big question. So to make sure I heard it correctly, it's what should we tell the future about how to.
You certainly can answer like that. I think it's really about, how should we prepare the next generation of alum to tackle these complex challenges? And you can answer, from the perspective of sitting where you are now. You can answer from the perspective of reflecting upon your training, however you want to tackle that.
Okay, so I have a few different perspectives on it. So one item I forgot to mention is that, so within Montgomery County, so I live in the DMV area, Silver Spring, Maryland. I actually serve as the vice chair on the Racial Equity and Social Justice Committee for Montgomery County. So working with the Montgomery County Council to think about and prioritize racial equity and social justice. And a big area of our focus is around ensuring that the COVID-19 pandemic doesn't set both health and economic, both the health trajectory and the economic trajectory of communities of color further back than they already were with regard to wealth disparities, disproportionate burden of disease, and the like. And in fact, there's another fun fact is that I'm actually on this committee with another Brown Public Health alum. That is very, very random, super odd, but glad to have company. So I shared that as an example to say that there are a variety of battlefronts in which we need our public health acumen to be applied. So you can be based right within a public health agency or an academic institution, or you could actually be sitting as both in some contexts as a public servant, so to speak, on this committee. So also encouraging people, if one of your aspirations is not just public health, but also politics, then I think whetting that interest would be really, really important. Because one of the things I think about was a very powerful experience I had within the Rhode Island Department of Health, where at one point, the state was thinking of giving the Rhode Island Department of Health the power to confer and to, what's the term for eliminate something? Revoke tobacco and liquor licenses. And from a health equity perspective, I'm thinking that's a lot of power, because then we can actually address the disproportionate number of tobacco and liquor vendors in socioeconomically deprived environments with high concentrations of Black, Latinx demographics. So I remember being super excited because I was like, yes, power in our hands, as opposed to let's gather the data, present this report, and then appeal to the powers that be. So I remember talking to my manager about it, and she said, oh yeah, we're going to decline that. And I said, why? She said, well, it's an ethical issue because we can't just revoke licenses in perpetuity. We'd actually have to confer these licenses, which would actually just directly confront with our ethical compass. Now, that does not mean ethical compasses are a problem. Those are in fact good. But it was also just a reminder of when we think about deep systemic change, do we want to, what is our level of proximity? So when I even think about my location within Amazon as a very fast growing, second largest, I think, according to it, can't keep up with the statistics, but I think it's still the second largest company within the United States. That's a huge employer in lots of different geographies and can kind of set the tone of, or the culture for not just tech companies, but also retail and supply chain. So thinking very critically about the experiences of inclusion for employees, not just around just aspirational diversity around how do we achieve it, but really thinking about it from a practical perspective around considering the holistic experience of employees and actually using a life course approach to ensure that the workplace is considerate of the socioeconomic circumstances that could actually put people on different trajectories, not just for how they work, but what does it mean if someone is working, but they also live at a further distance, or they have different care obligations, whether they be for children or elderly people, and they don't have the same free time to socially engage with their employer, and their employer interprets that as, oh, well, this person's not interested in a promotion, versus they just have different obligations than the person who lives up the street and can socialize at the bar, and then the bar ends up being the place where performance decisions or opportunities are talked about versus more equitable approaches to both evaluating performance and then providing people with the opportunity that can afford them professional advancement opportunities. So all of those different, the life course approach is a helpful model for even thinking about the employee life cycle and dynamics of advantage and disadvantage. So that framework can also be applied to a corporate setting as well.
Thank you, Shane. It brings us back to Kat's comments, really about kind of using the concepts and languages of public health and applying them in all sorts of different important ways to advance equity. So thank you for sharing that. Monique, you're next.
Yes, so I think as you stated, definitely COVID-19 has really, it has basically shone a flashlight on the disparities, and it has exacerbated the disparities that we knew existed, and they're still coming to the forefront. And I think one way in which we can prepare our future alums is to, practically just incorporate health disparities as a part of the core curriculum. I think that is one way in which we can raise awareness, and we can introduce students to the health disparities that exist, and ways in which we can advance equity. And I think by doing that, then I think the students will definitely become advocates in whatever areas they find themselves in. Like, I think this panel is a reflection of different areas that you can be an expert, or you can have your trajectory. And I also agree with Shane in terms of using a life course approach, in terms of just using that approach to help us understand that these health disparities are across the life course. So I think that's one of the ways in which I think we can really help our alums, is by just introducing it as part of the core curriculum of the public health program.
Thank you so much, Monique. And Kat, on to you.
Yeah, I think for the next generation of alum, and I guess this doesn't just apply to COVID, but just in general, is to think about what approach each of you wants to take in tackling these issues. So do you want to be on the data collection side? Do you want to take more direct action in the form of community advocacy or outreach or policymaking, or is there something in between that you're really that you really want to hone in on? I think it's really important to decide that first, because it can be quite overwhelming with the number of ways that one could use their public health training to make a difference. And there's a number of ways one could try to advance racial equity, thinking about this life course approach, like at what point do you want to sort of, where do you want to be? And so I think once folks kind of decide on the type of work that they want to do, I think then it's who do you want to do that work with, and where do you want to do that work? Do you want to do that domestically or globally? I feel quite fortunate to be working in a state agency that's prioritizing trying to build in some infrastructure for data collection. And we know in Massachusetts that our health insurance coverage rate is super high, but that health disparities still exist in terms of access and utilization and affordability, and that COVID has exacerbated those things. So at our agency, we're trying to prioritize, collecting more data on that, and getting it into the hands of the right people. But that's kind of because I love data, and so that's the approach that I decided to take. And I think future alums should just really think about how it is they want to approach and tackle these issues, and it's okay to be flexible. I think the great thing about public health, and maybe I'm jumping ahead here, but that it is this sort of multidisciplinary approach. And so we get a really wide range of information and a wide range of skills and knowledge that we can really use to make a difference. And so thinking about which of those things excites you right now and kind of following that.
Kat, it's such pragmatic advice. And I think that, especially for graduating students coming up, right? This next month, that's a question that's kind of pressing on their minds. It's a fabulous kind of transition. You've already started to touch on it to the last question. And just as I launch into that last question for this panel, I would like to invite the audience to use the Q&A function to input some questions. I can see that they're already rolling in, but just feel free to input your questions into that, and we'll get to them as best we can with the remaining time. So our last question for each of you is the following. Why is public health uniquely positioned as a discipline to tackle racial health equity? In some ways, you've answered this in different ways, but just wanted to give you this one final platform to share your thoughts around that. Shane, we can start with you.
I think it's vital, and because public health is so interdisciplinary, I think we're thinking about when we think about health, that's connected to vitality, livelihood, the root issue of what we're all trying to aim to achieve. And I think of a quote from, I'm not going to get the quote right, but Dr. Kamala Phyllis Jones, who's at Morehouse School of Medicine, but used to be the director for the social determinants of health within the Centers for Disease Control, oftentimes used to say that when we think about racial and ethnic health disparities, imagine all of the dreams deferred, the lives lost that could otherwise help us tackle some of these really complex societal and global challenges. And if we allow health disparities to persist with differential rates of burden of disease and death, we're losing out not only on people being able to fulfill their highest potential, but also larger benefits to society. So I think that public health, having that really direct connection to health, which can sometimes be extracted in lots of different ways as people move into different careers, allows us to always center our work in one of the most vital contexts ever, and that is people's livelihood. And applying a longitudinal lens, also integrating data at different levels. And that's actually even one of the things I really appreciated about working in the health disparities and access to care team, and then thinking about health equity. We weren't just thinking about rates of mortality, we were also thinking about what are some of the indicators of the social determinants of health, so we can actually be particularly creative and nimble around measures of both direct physical health, but then also proxies for health status. And I think that level of creativity offers just so much to any professional career, including public health.
Shane, thank you. Monique.
Yes, and I think it has already been said, and this is what I was thinking when you asked the question, is that we can look at using public health, we can look at an issue from different lens. And so we can, and it's such a multidisciplinary field, as has been stated, and whether we're thinking about collecting the data, we're thinking about asking the right questions, whether we're thinking about analyzing the data or public health advocacy, and then thinking about other fields that sort of borrow from public health. I think maybe I'm biased, but there are other fields that are sort of intertwined with public health. Even when we think about psychology, we think about sociology. These are other fields that can be intertwined with public health. So public health is, I think, a great field for answering these questions around racial equity, because we're able to look at it from different standpoints and from different lenses.
Thank you, Monique. I love that borrow from public health piece of it. Kat, you've already started to answer some of this, but I invite you to just add additional comments if you had anything else around this question.
Sure. Yeah, I don't have too much else to add beyond what Monique and Shane have already said, but I will say that it's been really nice to see the spotlight that public health has had during the pandemic. And it's like, yeah, we need to listen to public health practitioners in terms of like how to stop the spread of this vaccine this virus. And I think, if we can keep that energy with how we approach racial health equity and how do we improve that, and how do we pull in people from education or in government, community members to determine the best approaches to improve racial health equity. I think, it's really been spotlighted in terms of like this vaccine rollout. You have public health people meeting with community organizers and church leaders to really provide the evidence base around and like more trustworthy information about the vaccine to communities of color who have very good reason to distrust vaccines in the healthcare system. And so it's this way of pulling in the right people and working together to improve different outcomes. And I think, if we continue to work in that way, we can really combat some of these disparities that we've been seeing for a long, long time.
Kat, thank you. I can see that questions are rolling in, so I'm going to hand off to Jamie, who's going to read some questions from our Q&A function. Jamie, please go ahead.
Thank you, Caroline, and thank you for those that have already submitted questions. Some of them I was able to answer already, but we do have a question here. And it says, I'm now a research coordinator that does qualitative and mixed methods research on clinical medicine topics. However, I want to learn about other pathways that incorporate my skills, but are more focused on community engagement, coalition building, and ultimately advancing racial equity. Would you or anyone else have any suggestions or advice?
I can jump in first, at least. So I think the need for good data like analysts is high in a lot of different organizations, but I would argue, especially in sort of the nonprofit community organizing world, to get people who are willing to, draft up good questions for a questionnaire to bring out into the community, or who's gonna, once we do get all that data in, who's gonna actually crunch those numbers. And so I would, for the person who asked this question, I would encourage you to kind of look at where there's a need in different community organizations. I think, the data people don't have to stay over here, and then the community people over there, it can definitely be integrated. And so, yeah, just finding ways to get in touch with community organizations who are looking for a little bit of better data. I think they would be really glad for the help.
I would love to pose a question that your answer made me think about, which is that public health is really team science. And I suspect that in many ways, you each function as both part of an essential team as well as leaders of teams. And I think that's hard to navigate, right? So I just wanted to hear from each of you, what do you think makes kind of collaboration effective, especially around what I would say are sensitive and charged issues such as diversity, inclusion, and equity, and racial health equity? What do you think is effective as an approach as being part of a team to advance that work?
Yeah, I would chime in. So I think this is where, so Amazon, for example, is a highly matrixed organization. In the national consciousness, everyone thinks of Amazon as a tech company, but it's real. The vast majority of the employees are in supply chain and retail. And some people would argue that actually Amazon is the world of many startups, over 1,000. So within public health, we're working with data scientists, we're working with legislators, we're working with healthcare organizations, both based in the community, but also within hospital systems. And those are actually quite parallel in regards to highly matrixed organizations where people are convening to kind of leverage the talent, but we don't necessarily have control over one another in the sense of, I can't fire you if I work in a hospital setting and you're a public health agent. So I think from a collaborative perspective is how do we really think critically around what is the project charter? What are we aiming to do together? How do we actually leverage one another's roles? And then really think about an effective communication cadence and how are people owning their portion of the work to make for this really fantastic product? And then what I actually also appreciate about my public health training is because we're talking about health, we're also looking at burdens of disease and frankly, just death. And I think turning an unflinching eye to disparity is actually a really, really important part of the work. And it shouldn't be as much of a battle as it is. But when I think about the work around diversity, equity, inclusion, a lot of people oftentimes talk about it in a very high aspirational, positive intention frame, when we actually do need to turn an unflinching eye to death, violence, microaggressions, prejudice. And we are going to have incomplete pictures of diversity, equity, and inclusion if all we're thinking about is the hyper positive and the aspirational and the outcomes without really thinking about both history, present day realities, and asymmetries. So I think that ability to talk about quote unquote taboo topics and not be nervous around difficult or complex topics is infinitely helpful towards achieving the kinds of gains we aspire to.
Thank you, Shane. Monique or Kat, any comments? Otherwise, we can pose the next question or invite more Q&A from the audience.
I would just like to say, from the, like in academia, of course, collaborative teams are also very important. I've been fortunate enough to work with multidisciplinary teams, whether, you know, as an epidemiologist, working with biostatisticians, working with psychologists, sociologists, working with mathematicians. So I think it's very important that, as you refer to it as team science, is very important. And then we need these different areas to actually help us to understand how to get to the root causes of these disparities that we see. And when we have these different areas, it will, I think, will offer us varying insight to what we're trying to achieve in terms of advancing racial equity.
Thank you, Monique.
So the next question, oh, it looks like there's one that came in. Oh, it's not actually a question. So the next question that I'd like to pose is, I know that this work can be really hard and it can be emotionally taxing. What are some ways that you take care of yourself and keep yourself engaged and motivated to advancing racial health equity?
Take care. This is interesting. So this is going to sound very awkward, but part of how I take care of myself is also, one, just reading a whole ton. So I like to, my partner and my friends make fun of me because they were like, you read about like wealth inequality, health disparities in like your leisure time. And part of and it doesn't actually stress me out, but part of the reason I do that though is because I actually want to continue to both evolve my thinking or the language that I'm using to talk about these issues to continue to reach a broad audience. And oftentimes when I see examples of like the social ruptures that we saw last summer with the deaths of murder of George Floyd, Breonna Taylor, and the others, I see each of those instances as very striking reminders for why this work is so vital, and that even if how do I continue to leverage anguish to really power momentum around fighting for change, and as dynamic and versatile and nimble, and thinking about, okay, well, if I'm accustomed to working in a particular industry, what are some of the unconventional partnerships that we can pursue to advance health equity? Because we need to get as many people as humanly possible in this conversation. And one day I'm going to figure out how to do something with the NFL. Like there's going to be some public health halftime show that's going to get people activated around fighting for racial equity in a really substantive way. Because I think that we have to think about, obviously death ends up creating a level of urgency around these issues, but how do we think about people who are just like, okay, well, I'm not mad or upset or in anguish, and how do we make sure that even people who are in a cold emotional state can also get activated in this work and see it as vitally important? I think of that even happening with some of the work with Trisha Rose's work around looking at the gears of structural racism, around how do we actually switch the comfort offered by the status quo, which has a high threshold for Black death, and kind of create an emotional connection to equity and change and a multicultural, progressive, democratic society. So that's what keeps me in my self-care.
Thank you, Shane.
So for me, I think I can sometimes get overwhelmed by the number of things that I should be doing or that I could be doing, and kind of having decided on this, like I'm going to be in the data, and that's going to be the way that I try to advance racial health equity, even if I'm not seeing the immediate results right away. and there was a lecture that I attended when I was at Brown, and the speaker said, it was, talking about social justice and health disparities. And the speaker said, pick one thing and just do that, right? And so, kind of taking a step back when, like, in these moments, especially last summer, there was so much going on, there was so much conversation. It's like, it's either, there's just so many different things that we could be doing, but taking comfort in the fact that doing what we're doing now, having made a decision about how I want to approach racial health equity, like, that's okay. And that doesn't have to line up with what everyone else is doing or what it appears as though everyone else is doing. And so I think that is self-care in and of itself, right? That, like, the work that I'm doing is enough for right now, as long as it continues to move things forward. And, as long as my passions are still in that. So I think just taking a step back and being like, it's okay to choose this lane for now.
I think in terms of self-care, I mean, yes, the work can be very taxing, and it can be a little bit challenging at times. But I think I don't know if we're, because Shane reads on health disparities for self-care. Kat is thinking, okay, this is my lane for self-care. I don't know if we're that great at self-care in general, but because we're always working, it seems. For me, I just, I'm always thinking about, I guess similar to Kat, is like, I'm always thinking about, okay, for my next project, how am I going to address, disparities? Like, if I'm interested in a specific research question, now, and I think recently more so, I have a very conscious thought process in the terms of, okay, how am I going to address health disparities in this research question? And so I don't know if that's self-care, but it definitely helps me to know that I'm doing my best to play my role in addressing health disparities with the aim of advancing equity.
Thank you so much for taking the time to answer those questions. I see that there is a question in the Q&A, and it's for Shane. And the question is, Shane, what suggestions or resources could you share to help our organization, the Zana Foundation, identity and put proxies in place to measure health outcomes beyond increases in levels of activity, weight reduction, et cetera?
Great question.
Got a minute.
For the person I'm going to answer the question for, and for everyone else, feel free to connect with me on LinkedIn. Also happy to continue the conversation beyond this time. And then with regard to the question, I think that if we're thinking about proxies, really partnering with local community organizations to get a sense of what their needs are, because I oftentimes find that it should always be directed by the community and holding them at the center. What is the level of green space? What is the access of, safe places to play? Do people have access to sports equipment, for example, or exercise equipment, and what can that do? And then what are some of even partnering with a local gym, so maybe Orange Theory or some other organization, and asking them, well, what is your community partnership practice? What are you doing for corporate social responsibility? And seeing if they're willing to lend trainers time to help facilitate low cost or free fitness activities as one of the ways that can potentially help. And then I think the other part too is considering social distance, also working with local organizations to figure out what are some of the spaces that allow people to be in community together, physically working out without violating social distance, as we're still in the midst of a pandemic, and maybe people are willing to kind of loan out facility space that can help accommodate some of this as well.
Thank you so much, Shane. So we are out of time. So I just want to say that this has been a very important and invigorating conversation, and we hope that it serves as just a start to future synergies. And I want to thank each of our panelists for spending this precious time with us, and also thank everyone for attending. And we hope to gather again, hopefully in person soon. Stay well, everyone. Bye-bye.